Hello and welcome. And today I'm very pleased to introduce Dr. Chadi Nabhan, who is an oncologist. I'm sure there's a longer word to go with oncologist.
It's
Uh,
okay.
And we're going to be talking about your book that I think has just been released. Oh, once again, sometimes this works, sometimes that doesn't. That is just not working
See,
today.
that's why I have the background, so you could see it right there on my background. But there you go. I
There
think
we
there
go,
you go.
got
The
it.
cancer journey, it worked. It worked.
Yeah, well, hurrah. It is definitely hit and miss for me. Where Chadi actually takes us on the journey from, very much the beginning through to actually the future of cancer. Um, I'm very fortunate. I hope this isn't doomed by saying it, that I don't actually know very much about cancer because I haven't been touched really by it, or people I know. So I count myself very fortunate. But for a lot of people, I think this will give, and to myself, it was very, very reassuring reading your book, how it's presented, and all of those things. But before we go into the book, Chadi, would you like to give us a little background of how you find yourself writing this book and also why you wrote the book?
Yeah, thanks for having me. I really appreciate it, and I'm glad to share a lot with your audience. Um, so I'm a cancer doctor. I've taken care of patients with cancer for over 2 decades. Um, and throughout the years, you realize that there are opportunities to simplify things to people who are either suffering from cancer themselves or they are dealing with through their family members, friends, colleagues, or they just want to know, they want to learn. I mean, we are curious creatures. We would like to learn because we hear that word thrown around us all the time. And what's rather interesting is that the learning, the way we consume information varies. We obviously use the internet and Google every time we want to learn about something. And I realized that despite the ubiquity of available information, I mean, still a lot of people are confused about certain terminology, about certain elements pertaining to cancer. But the underpinning of all of this, Catriona, is that health is the most precious thing that we possess. It is absolutely the most precious thing that we possess. And when our health is threatened, we become very vulnerable people because now our most precious thing is being threatened by something that could be serious, maybe it's not, but there's a threat. And when we are vulnerable, and if we are dealing with something pertaining to cancer, all of a sudden, our entire life changes. The trajectory of our life changes. We can assume that we are very immune, we're strong in all of this until our health is threatened. During that vulnerable period, when we are being affected by something like this or dealing with something like this with loved ones or so on, we must literally meet someone who is new to our lives, the oncologist or the doctor who's going to take care of us rapidly. And we have to establish the rapport and the trust, and we have to execute on a treatment plan and proceed all of this in a matter of a couple of weeks as our life is upside down. So this is a very, very tough period in anyone's life, wherever, whoever you are. You don't have to be the patient to deal with this. So I really wanted to spend some time to write a helpful book or a guide or a companion or something that's really going to help guide whoever that individual is through the process from A to Z. This is not like any other cancer book out there. It's really, I thought through it. How do I really put myself in the patient's shoes and go through the journey? What actually happens to me? First, I may not have the cancer, so I'm screening for it. Second, maybe I started having it, symptoms and signs, diagnosis, all of these things, and go through the process. But this is not just a patient book. This is for anyone who really wants to know about it. The last thing I will say, and I'll shut up, I promise, is that how do we effectively share the information is key because the goal is to reach as large of an audience as possible. And the way to do that by simplified language and plain language and by storytelling. So this is not a textbook. I'm not lecturing people. This is, you will read when you read this book, stories of people, of families I took care of over the years. These are all real stories. So you'll identify with some of these stories. When I tell you about somebody who walked into my exam room, your human brain will assume I'm walking into that exam room. So you can really relate to these stories. And as long as I'm continuing the theme of simple language, easy language to read, then I could reach a lot of people. If I'm really reading very heavy medical language, you'll probably get through 2.5 pages and then you're going to put it aside because you're just not going to be able to continue reading it. And because you feel somebody is writing a textbook and for medical school and preaching. And as you read the book, this is not what it's all about at all.
No, and I have to say that I found it super easy to read. I didn't feel that I was being spoken down to. I felt that actually you were my friend. And I have to say that if something awful happens to me and I do have cancer, I will be flying over to see you because I
Oh,
want
you're
you to be my
well,
oncologist.
hopefully you will fly only for tourism, I wanted to empower people.
Mm,
I wanted to empower people. Information is power. When you know a lot about something, you become powerful because now you are aware. When you know nothing about something, you don't have that power of knowledge. But there is a lot of information out there that, I mean, that's the key. The key is, well, somebody may be watching this and says, well, I mean, I can research this on my own and all of this. And of course you can. But there are so much out there, so much that you'll get overwhelmed. And being overwhelmed in the most vulnerable period of someone's life is a problem because then you're going to make wrong decisions. When you're not completely there because of being overwhelmed, you could make wrong decisions. And because there's a lot of information out there, I wanted to filter all of these down. I want to make sure, separate, I always tell people, let's separate signal from noise. Is what we're reading real? Is it just noise?
and I think you very successfully did that because it made me because of how you conveyed the information, it made me understand it, which then would allow me, I didn't feel frightened, which didn't mean that I shut down. You know, like your brain suddenly goes, oh my God, I don't want to know
Right.
anymore. It made me think, oh yeah, okay, that's that piece of information. I'm now going on to the next piece of information. So it was very encouraging as well as the reassuring bit that I said. Now, just before we started, I went through some of the points that I thought that sprung out to me. And obviously for other people, other bits would spring out to them. But I think one of the things that I thought was really interesting was that how you made it very clear that having a biopsy was very key for the beginning of your journey.
Right. I think it goes back to what is cancer as a disease. Cancer is really, and I put that in chapter one, what is cancer and what causes it. But cancer is at the end of the day, is basically overgrowth of cells or the cells are not dying. I mean, our body has cells all over. Every single organ in our body is composed of cells. That's why, unfortunately, we could get cancer in any organ. But essentially, what happens to these cells it is what defines cancer. Either these cells grow in uncontrollable fashion, or they don't die the natural death and they get replaced by new cells. And that leads to growth and tumors and so on. Well, because of that, you can't really tell what you're dealing with without really seeing these cells under the microscope. And how do you get to see these cells under the microscope? You perform a biopsy. So, what I wanted people to know is, you know, unless you really see these cells that are abnormal under the microscope, over 95% of the situations you can't really tell. Now, there are times you will suspect it very highly because of some abnormal blood work and things like that. but still you can't really be 100% sure without doing some form of a biopsy to some organ. That could be breast biopsy, could be prostate biopsy, could be bone marrow biopsy. Ultimately, we must be able to see these cells under the microscope. There are a couple of exceptions, by the way. I mean, if somebody is watching this and they are very well versed in the oncology medical literature, there are a couple of exceptions, but we're not talking about the exceptions here. We're talking about the rule. A biopsy is needed. It has to be really looked at. And it's becoming really, there are so many types of various cancers that could occur in the same organ. So, for example, there are different types of lymphomas out there. Lymphoma is a form of cancer of the lymph glands and things like that. There are like 60 types. Well, how are you going to tell if there's a lymph node that's just growing? You have to take it and really examine it to know which type we're dealing with and things of that nature. I wanted to explain that, and I'm glad you picked on it because it means it hit home.
And I think the way you explained as well, and I had no idea, is that when people have secondary cancer, you treat the secondary cancer. It doesn't, so if you get it in one part of your body, it goes to another part, you'll still treat the second cancer because it's the same as the first cancer, generally speaking.
Right. It's the same cancer that has gone elsewhere. And it's not unusual. I would get a question, and I shared several stories, as you could tell from the book, is, sometimes you have somebody who says, well, aren't you going to treat my bone cancer? And I'm like, well, it's really not bone cancer. It is thyroid cancer that has gone to the bone, for example. And that's really what we should be approaching, and that's what we really should be treating. So it's critical to treat the underlying cancer, the mother cancer, if you will. But there are other therapies that sometimes you could add or implement to improve the situation when the cancer has gone elsewhere. But ultimately, you're treating the main cancer. That's ultimately what you're doing.
And you give a very comprehensive overview of all the different type of
Yeah.
treatments that were available. And kind of by the end, I was thinking, oh my God, which one would I go for? I mean, fortunately, I wouldn't be choosing that, or I may be in discussion because someone had explained to me. But I hadn't sort of, everybody's heard of chemotherapy, radiation, but all the other things that you hear those words, but you don't really understand what they are and what they do. I just thought that was really interesting.
Yeah, this was a bit challenging to cover, to be honest, because it's really difficult to cover every single kind of therapy that you could do, because I wasn't talking about one specific cancer or another. I
No.
mean, my book wasn't about breast cancer, about prostate cancer, about thyroid cancer. It was about cancer in general. So I was asking myself, how do I really talk about the treatment of all cancers, essentially? And the way to do that is look at the categories of therapies and then simplify that. So sometimes we don't need to, not every cancer needs all of these therapies. Some cancers do, some don't. But essentially, I want to talk, well, what is chemotherapy? When people hear the word chemotherapy, what do we actually mean by it? I wanted to distill that myth. I want people, when they hear that word, look, we're human. We are not going to be saying, well, yes, give me some chemotherapy. That's never going to happen. But I don't want people to be scared. I want them to understand that this is just drugs, that this is what they do. They kill the DNA in the cell and they kill these cells. What is radiation therapy? I wrote this in the book. Every single book is all stories. In the book, I told people when I first heard the term radiation therapy, I was thinking of, like, the Chernobyl disaster that happened, like, some, like, because I was in medical school at the time, and that was, that's when it happened, and it's not the case. So I'm pretty sure I'm not alone. When a layman person hears the word radiation, they're gonna think all kind of things. And for me, if they read this book, they know, okay, this is what it is. It's not really some esoteric thing I was thinking about. So yes, I really wanted to go over a variety of therapies. Part of this, by the way, is to really explain to readers that we have had so many advances in the way we treat cancer. And I think it's important to explain why I am positive, why I'm optimistic, why I believe that we are transforming cancer into a chronic disease. This is not a disease that, I mean, we have many patients that live with this disease for years and years, and it's controlled and it's doing well. Others are cured. So we should really be optimistic. So when people read all of these types of therapies, I hope that they will share my optimistic view. One chapter specifically I would encourage everybody to read is about immunotherapy and how the immune system suddenly became so important in fighting cancer. And I explain why, because people don't understand, oh, okay, I understand. The immune system is our guards that really protect us against foreign invaders. And if it's kind of weak, the invaders go in. So I do it hopefully in a way that's very easy for people to understand.
Which sort of neatly goes on to complementary therapies and then people's beliefs about, I think I mentioned to you the bit that I thought was quite interesting was a sort of people saying don't eat a certain type of food, don't have sugar.
Yeah.
And you're very good at just making that very clear what you feel.
Yeah, well, who
Mm.
hasn't dealt with complementary therapy? If you've ever had a cough or a cold, I mean, if I have a cold or a cough, my mother would tell me all kind of things I need to do, and some of them may be right, some of them may be wrong, but we tend to always uh, um, kind of gravitate to that. Now, why do we do that? I mean, let's think about our human nature. Because the alternative, when we think about chemotherapy and radiation, all of these things, all what we think about, or all of these side effects, the disasters, all of things can happen. So naturally, we are going to think, are there other remedies that I can actually implement that might help my disease? This is not, it is something that everyone thinks about. It's part of our human nature. So I wanted to really research and try to better understand what patients and families could actually go through and ask about, and is there any truth to it or not? So I talk about diet, I talk about vitamins, I talk about all kind of things and research the evidence, the literature, and then come up to conclusions. I think it's very common. I heard a lot about people telling patients and families don't eat sugar, for example.
Mm.
And so I'm like, okay, let me just go and research what is out there. And there are articles say sugar is the white death, like literally. Like, oh my God. Like, so basically, if I want to have an ice cream, I can't have an ice cream. So there is no truth to a lot of things that you see out there. The reality is that the way I would summarize this, it is very important to keep a balanced diet because gaining a lot of weight is not really advisable. And there's some link between obesity and certain types of cancers, such as gallbladder cancer and uterine cancer, as an example. So it's good to always watch your diet, but maybe that's not really the exact time to do that if you're really dealing with cancer, because you want to get your nutrition, you want to get the calories, you want to, you may lose weight anyway because you're getting other therapies. So you really want to maintain your strength. And I came to the conclusion that it is okay to take certain vitamins. It is okay to take certain things as long as you know why you're taking them. So if you come to me, Catriona, and you say, okay, I want to get a multivitamin a day, and I will say, okay, you should take multivitamin. It doesn't hurt you. I mean, why not? I mean, it's not going to be an issue. It has some minerals in it and some few vitamins here and there, and that's fine. Now, if you tell me, well, I'm going to take this multivitamins because if I take it, I will never get cancer. Well, then I have an issue with that because now the motive, that's why you're doing it, is not, there's no premise to that because that's not going to happen. It doesn't really prevent it. But if you tell me I'm going to take it because it makes me feel good, sure, why not? I mean, we ultimately we physicians should not be robots. We are about human interaction. It's really important to understand the motive and then explain right or wrong. So if you tell me, I'm gonna cut, ice cream from my diet because I'm trying to lose weight or I really don't like the taste or whatever it is. I'm like, okay, I'm gonna cut ice cream because I think by cutting ice cream, I will reduce my risk of getting cancer. I'm like, well, hold on, that's really not the right motive. So I believe we need to understand what drives certain decisions about complementary therapy and things like that, and then explain which was true or not. And I go through the entire process from red meat to even cannabis and marijuana, which, by the way, I mean, again, I'm not really telling people that to go smoke marijuana, but I have had patients who really benefited from that. It helped their pain, it helped their appetite, it helped reduce their nausea. And I share stories when my patients were asking me, I would say, sure, if it's helping you, you could do that. So hopefully that chapter helps a lot of people because I certainly saw that with my patients and families all the time. And I share some
Mm.
stories with that of how many supplements they were taking.
Yeah, and I think it's really good, and also to be very aware of anything that says, take this pill and it will cure. I can't bear anything that
Right.
says that. That always worries me. Which I suppose then is slightly leaping around. The other thing that I found very interesting was about hereditary cancers. And you sort of put in my head what hereditary really means.
Right. Right. I think naturally, when we when somebody gets diagnosed with cancer, there are a couple of things that could go through their mind. Number one, and again, remember, the way I wrote the book is to try to think what goes through people's minds. Number one, am I going to pass this to my children or other family members? That's normal to have that concern. And number two, did I get it from my parents or my family? And if there is no family history of cancer, it's like, well, why did I get cancer? Like, there's no one in my family that has cancer. And I think what is critical is that when you look at all cancers broadly, the minority of them all have a hereditary component. And when we say hereditary component, we're saying there's are genes passed on from one generation to another. That is what hereditary cancer means. It means there's a gene, let's say, in the father or the mother, and goes into the daughter or the son, and so on and so on. And those do exist, they happen, and there are some genes that could go on through generations. And some of these genetic composition could lead to the development of cancer. But the majority of cancers are not. The majority of cancers, there's a genetic alteration that occurs, and that genetic alteration leads to development of cancer, but it could not be taken, it's not coming from anybody else. Now, why does the genetic alteration occurs? I go through a variety of things. But I think for those who are watching, the hereditary component is the minority. It is important to ask the question. I'm not discouraging people. I think it's critical, but that's really, it is not unusual for us to see cancers develop in people who don't have a family history of the disease, or, I mean, somebody has an uncle who was a smoker and got lung cancer. That's not hereditary cancer if the other individual gets cancer. So most cancers are not hereditary.
And I think, as you explained very much at the beginning about genes and understanding the role that genes play and how that makes it very understandable as to you're not passing a particular cancer onto someone, it's within the genes and all of those things, which sort of all made sense. And I think for you must find that with a lot of people when they do get cancer, it is, well, why? Why me? And being able to understand from the beginning how it could have happened makes it
Yeah.
easier to understand, possibly.
Yes. Yes. Why is the biggest question, isn't it? And I wish we know the answer to that every single time. Reality is we don't. Most of the time, we do not know why cancer has occurred. We know what cancer is. Like I said, it is this dysregulation of the cells that compose an organ. It's basically like every organ has cells, and I draw the contrast in the first chapter of a building. Think of the organ as a building, and the cells, the bricks that compose the building. And these bricks, you have tear and wear in the bricks, and the cells happen the same, all of that stuff. So why? We don't know in many situations why these genetic alterations occur. Sometimes we do. So we have become aware of certain things that we do on the outside that might affect our organs. I mean, again, I'm going to probably give examples that everyone who is watching this knows, but I think it's worth repeating. I mean, tanning bed and just staying in the sun for 10 hours and baking the skin and getting the skin that's just, I mean, this is a recipe for disaster where people could get various forms of skin cancers and things of that nature. Everybody knows about the risk of smoking, but we are now more aware that smoking it could increase the risk of other cancers beyond just lung cancer, such as bladder cancer. I think alcohol is something that people are not aware of as much. And it turns out that alcohol is a carcinogen. It does cause cancer. Now, this does not mean that no one should ever have a glass of wine or a drink. What it means, we just don't know what's the minimum or maximum that somebody could do without increasing the risk. But we know it does actually increase the risk. So I feel like as long as I mean, if you don't drink, that's fine. But if you drink, moderation is key because there's definite risk of developing cancer because of alcohol and other things. There are certain bacteria and viruses that we knew that are associated with some cancers. I think with time we're going to learn more. What are other factors that lead to these genetic alteration in our cells, and eventually this leads to development of cancer in one organ versus another.
And I think, as you alluded to, or you actually said blatantly, is that your book has lots of examples. Most chapter has a conversation with a patient, and those conversations obviously are what your experience, but you can hear yourself as a patient asking those questions as well. And it's quite nice to sort of see it, as opposed to quite often you feel that the medical community or the profession rather will brush away somebody's concerns, and what you are very clearly showing that you don't, and explain it. So moving into communication, and I think there's a lot of your book, and I haven't seen that in so many in cancer books before, is there's a lot about how important communication is with directly to the patient, but also including the family, because that is just as important in many ways as well.
It's so important. And we really have to not dismiss any type of a question a patient asks. If you are buying a house or if you're buying a car and you go in and you're asking questions about the car and the speed and all of these things, and the car salesman is rolling their eyes over and they're really not taking your questions seriously, you're not going to buy the car from that person. You're asking reasonable questions. And that's buying a car, which your health doesn't depend on it. It's just a luxury to have one. So when you're vulnerable and you have something that's threatening your health, you should be entitled to ask all questions that you actually want to ask. And it is the job of the healthcare establishment to explain all of this to you. I have an entire chapter on communication because I think this is extremely important, and a lot of the dissatisfaction that occurs between patients, families, and their caregiver, their healthcare professionals, is because of breakdown in communication. And as you know, I wasn't shy away from sharing stories that I was personally involved in. Every single story that readers are going to read in the book, they're 100% true. There was no blemish in any of the stories. I just obviously just took away any confidential information, such as names and things like that. But yes, communication is key. There are times where I thought I communicated effectively, but in hindsight, I probably didn't. The way I look at communication is that if the recipient of what I'm trying to say is unable to understand, absorb, or comprehend what I just said, it's not because they're stupid. It's because probably I could communicate more effectively. And unfortunately, there's this inherent bias in the medical establishment sometimes. Well, I explained to her or to him, they just don't get it. Well, probably you didn't explain well enough. That's why they didn't get it. It's not their fault. We're all smart people. I mean, but there's this bias. It does exist. I've seen it. And maybe I was also guilty as charged in some of these situations. But I learned my lessons. And I've actually always kept two folders on my desk. One folder that has all of the greeting cards and thank you and all of these beautiful notes that patients and families send you for being by their side. And the good news is that folder was by far the larger folder. But I did have another folder where people took the time and wrote to me because they were not always thrilled or they were not happy. And I cannot tell you how many times I read those. I never forgot every single story where I felt that I may have failed a patient or a family. I knew deep down inside I've done everything I could. It's not like I didn't do anything. And I knew that my medical care, the medical care piece, was the right thing to do. But at the same time, my patients and families were not satisfied. And they took the time to write that to me. So that means I could have done a better job. It doesn't mean that they're difficult people. We just need to get out of this mentality that if a patient is asking questions or not happy with certain situation, they're not being difficult. For God's sake, they're the ones who are sick. They're the ones who are getting the treatment. It's not you. They're the ones who are gonna go through the side effects and everything. So yes, fine, communicate in a different way. It is the most important part, in my opinion, and I think we could do always a better job. Unfortunately, nowadays everybody is so busy, there's so many things, you have patients after patients, and the time slots are small, and what does that mean? That leads that the communication is a bit truncated, but I actually provide some tips into how I dealt with this. Not to take a lot of time, but just an example. Let's say somebody comes to me and they have 40 questions on their list. I shouldn't be rolling my eyes over. I'm not going to be able to answer 40 questions in a 20-minute visit because if I take just 1 minute per question, that's 40 minutes and I still have to other things. But what I would do is I would say, okay, give me the top four you want me to address today because I have other patients and I promise you I'll call you today and tomorrow we'll go over the rest. The patient felt heard. They also can understand because they could be the other person waiting in the other room. But just do it in a courteous way, do it in a way, and I don't want to be lecturing my colleagues or my physicians. My goal is just to make sure what I went through, and maybe they can relate to it, and there are lessons learned there. So communicate effectively, frequently, and be empathetic and sympathetic with the people who are sick.
I mean, I think you're brutally honest in that part, and it made me kind of gosh, and I think and I know the book is also written for, the profession, the medical
Yeah.
profession as well to read. And I thought that bit was really, I think it's very hard when time constraints for any appointment, but also I think when you know a subject so well, you forget that other people don't.
Yeah.
And not only that, but also if you're not well, you're going through all the other emotional baggage, not baggage, but that you're going through, you can't hear things. And it is a reminder to the medical profession is like, yes, you're the person that is controlling this, that has the knowledge, and it is your job to make sure they understand it. the trouble is, obviously, is sometimes when they forget it. And I think, you know, your hints and tips about what to do is make sure you read as much as you can, take somebody in with you, take a note, and, you know, you give out lists of questions to ask, which are really practical things to help. So I think as a patient, yes, the onus, one would say, is for the doctor, but the patient has to help themselves as
Yes.
much as they possibly can to make it an easier journey, because I think if you do that, it makes the journey and everything easier for the patient and the doctor, so that
No, no one's going to advocate for yourself more than you are.
yeah,
And I want to make sure that this is a powerful guide to empower the patient to be the best, their own best advocates.
yeah. Having said that, I've waffled on a bit now. So the last sort of thing that oh, I just wanted to say that the bit that I thought was very, very helpful and good is how you tackle the difficult questions when, you know, the outcome is not what you had hoped for. And you go very well into how those conversations can go and what it means, and that you're not giving up. And I think the bit that for me that actually helped me personally was understanding the bit for when I think remember my mother died was, you know, you think somebody's really suffering, they look dehydrated, should we be giving them something? And you explain that actually this is the process of death. And I found that really moving, to be honest.
Yeah, I mean, it's very difficult to let go. It's very emotional. I think we assume sometimes if our loved one is not getting the fluids or the hydration that they're suffering. And I have to sit down and explain they're actually not. Actually, by giving the fluids, they probably will suffer more because you're gonna get more of the the swelling of the body and things like that because the body is changed. And I have many family members who would really say that, you know, the they're not eating, they're not, we need to feed them because they get the hunger pain. And I'm like, no, they actually, there's no hunger pain. So I think that I wanted to make sure I explain where this is coming from, but it's very difficult to know what we will do when we are in these situations. You know, doctors sometimes and healthcare professionals, we occasionally forget that there's a human nature that's really making that decision here. This is not a textbook. Every decision, there's behind it, there's a motive, there's a reason. You never know why this is really happening. But so we need to take the time to sit down and explain. But distilling certain myths, such as the fluids are going to revive me forever, and the transfusions and the things like that was very important for me because I've gone through it with a lot of patients and families.
No, that was great. And one last thing is the future. I was going, the future is AI, which I know is something you mentioned that you were looking at, but generally the future of cancer is incredibly positive. And I think just looking back over the last 10 years, you can see that is true because, you know, we've just talked about how it's gone from being, you know, an acute condition to now it is a chronic condition for many people, and how you can possibly live your life carrying on with cancer, but carry on living with it.
Yes, and that's really key. I really, hopefully, anyone who reads this book is going to see the positive spin on it. This is not quote unquote positive spin that is not real. This is actually all factual and there's data behind it. And I provide some statistics to show how many people are living with cancer. There's a lot of elements in the future of cancer care. And I have to admit, it's probably the chapter that was one of the most difficult ones to read because it's so difficult to write like 20 pages and say this is the future because every single element could be a book by itself. There are people who wrote a book on virtual visits. I mean, so I try to get like snippets of where I think things are changing. So I talked about the virtual platform that probably people are using more virtual and probably it's going to continue, but there's maybe some situations where it's okay, some situations where it's not. And I talk about AI, artificial intelligence, where I think really there's a lot of opportunity there in artificial intelligence to shape and refine how we take care of patients, how we develop drugs for cancer, how we can help people. And as I just told you, I am writing a book on AI and cancer care because I believe that this is really the future. But I also talk about how now we sequence tumors. So, for example, anytime there's a tumor out there, we can look at the DNA and the RNA composition of the tumor because this allows us to understand which is the better target against that cancer, or how do we design drug for this particular cancer, and all of this. And I talk about regulatory aspects about cancer care delivery. Sometimes patients could go into the clinic and they don't see the doctor; they see the nurse or the nurse practitioner, and that's okay because they are part of the medical team, and we have to make sure that this is actually why this is happening because of so many patients and the supply demand formula. So the Future of Cancer Care book is just basically taking kind of futuristic look into 5 years from now where things may land and maybe a paragraph or two about every particular aspect of it. But I think the future is bright. This is the goal of all of us who take care of cancer patients with cancer is to make sure that number one, the quality of life is maintained. Number two, they live longer and better. And if we're able to transform this disease that once was fatal into just a chronic disease that you can live your life normally with it, then it becomes like living with high blood pressure or diabetes or any of these chronic diseases we live normally with. And that's the goal. And I believe we're very, very close to achieving that.
Yeah, well, that's a very, very positive note to end on. So thank you very much, Chadi, for your time. It's really illuminating. And I would encourage everyone who wants to know more about cancer, whether it's just for themselves, whether they're going through cancer with a family member, but to be more educated is definitely very important. So thank you.
Thank you so much for having me. I appreciate and look forward to talking with you more.
Thank you.